Our 2016 annual conference has been a real turning point. For the first time, we set aside a full day for medical professionals, the specialist allied healthcare professionals who run our clinics, lymphologists, nurses, physiotherapists, plus the surgeons and researchers who are the real pioneers to whom we are all looking for a cure. We've all come a long way in 4 years, and this year's conference was the moment to ask, where do we go next?
The great thing about a patient-led organisation like Lipoedema UK is that the world does tend to start to listen to patients, particularly if they're good at expressing the needs of patients and advocating for them. I think our experience over the years is that patient voice is being listened to more now, and working together with healthcare professionals I think is a very powerful combination.
Things have really been moving on. So even in the last year, one of the surgeons here, Anne Dancy, was saying how she's noticed that people's GPs are recognising the condition much more quickly. And that's surely largely in part to things like the Royal College of GPs module on lipedema that Lipoedema UK funded. So, the medical community is beginning to listen. All the work and all the campaigning done by Lipoedema UK and lots of other organisations and other individuals, it's really making a difference. So we've got to carry on with that advocacy.
And continuing to make our voices heard by both the public and the medical profession is one of the tasks ahead, especially as we're increasingly attracting international recognition.
A group like this is very important because Lipoedema UK has done a lot to talk about lipedema, to inform the society and the health staff about lipedema, to bring patients together, to give advices. And maybe they will also have some influence on the health policy in England.
Ultimately, that's our aim, arguing, for example, that liposuction should no longer be seen as purely cosmetic, but as a mainstream procedure available on the NHS.
It is a very effective therapy. To be honest, up till now, for most patients, it is the best available therapy because it improves the shape. It removes the pathological subcutaneous fatty tissue and it improves the symptoms of the disease.
The conference proved that Lipoedema UK is attracting the brightest and best of international expertise.
I would just like to say I'm absolutely overwhelmed with the quality of the presentations today and the knowledge that we've had.
And so it's our intention to build on that foundation, drawing on all the available knowledge, not only in Britain, but worldwide.
I would strongly suggest to make it much more an international movement, because we can help each other, we can learn from each other. As we saw today at the Congress, that the Germans are very good in treating the first stages of lipedema, and we concentrated on the worst of the worst. So we have a very good complementary attitude and possibilities.
So we'll continue to bring together experts in every discipline: liposuction, lymphology, genetics, compression, nutrition, physiotherapy and more, with the ultimate aim of finding a cure.
The first step of coming towards a cure is understanding more about the condition itself. What is lipedema? Why does it happen? And the St George's team do believe that genetics plays a strong part in the cause of lipedema, and hopefully with our research project that's now up and running, we'll be able to identify the underlying gene mistake that's caused this condition. Clinicians actively involved in the management of lipedema have come together today. They've discussed their research findings, both published and unpublished. They've discussed their thoughts on the etiology of the condition, why has it happened, and the discussions have stimulated lots of research questions that I think all groups are now going to go away and do some thinking about and improve the research and treatment that they can offer their patients. It's been invaluable.
We need to keep together as numbers. We need to, all of us, in our own little way, approach our GPs, our MPs, our hospital CCGs, and I think that's a really important point to make, is that every CCG, the area that you live and work, they have workshops, they have meetings that we could attend as an individual to point out that we have a condition called lipedema which affects quality of life. Without that voice as a whole, we're never going to be heard.
Okay, this is the scary bit. You have to come out of the box, because as a lipedema patient, I spent 43 years trying to hide. I would dress in black. I wanted to be in the shadows. And what we need to do is say, we're here. We have a disease. We're not fat. We are trying to do everything we can to improve our condition, but we need health professions behind us.
Which is what we're committed to doing in the future, and it's a matter of great pride, incidentally, to see our charity valued by the medical professionals themselves.
Oh, they're doing wonderful work. They're supporting the patients that have this condition. They're giving them advice on where they can go for help, because it's like a minefield out there on the internet. Patients will go and find Facebook sites or other sites that perhaps they don't find very helpful. They might find more confusing than useful. But I think Lipoedema UK is doing an amazing job in providing evidence-based advice and support to these patients and improving their care and their quality of life. And hopefully we'll continue to work together with them to find this cure one day.
So my thanks to our growing community of Lipoedema UK members, whose efforts are vital to making this condition a thing of the past, but it does need our constant commitment.
Today, Lipoedema UK is running a conference for around 100 medical professionals, and then over the weekend about 200 women, and that's massive. That needs a lot of money to put events on, which are very important, and then to have money for research, because doing research and publishing research has a cost. So yes, it's very important that we do raise money, and the sort of campaign for 75 for 75, trying to find ways of raising £75, which is a manageable amount that you can think about. It is important that we understand the value, that actually we can all make small contributions, but they're all what will add up to the breakthroughs.
So help us to help each other, either with time, money or voluntary support, because it's you, members like Sherry, who in the end are our most precious resource.
I think my responsibility at this moment in time, having actually had surgery for lipedema, is to be brave enough to show the world that you can come through this. You can turn from a shadow in the background to somebody who is proud to be alive and who starts living life again.